briefly go over the nose and why we would do Nasya and Jala, Neti, which are procedures to kind of clean out the nose and lubricate the nose and oil the nose. So just briefly, here's a cut right through the middle of the face, and you can see the side of the nose here. And what you see up here is all the little fibers from the olfactory organ up here, the olfactory blood. So this is where the smell fibers come into our nose, and they pierce what's called this bone up here, and they come into the nose. So this is one area in our body where the nervous system is directly in contact with the outside world, right? So thus, from doing something inside the nasal cavity, if it's done in the proper way, can actually affect the nervous system directly. And thus, this is why people are addicted to cocaine and sniff cocaine, because it's a quickest way to affect the brain. So we can do the same thing, but we can do it in a safer way using Nasya. And so I just wanted to show you, so here's a nostril. Now the septum, the midline partition in the nose is missing here. So you're just seeing kind of the side of the nose from inside, but you can see this whole part here. And you can also see that this is that cribriform plate I was talking about, where the actually perforations and part of the arachnoid matter, which surrounds our brain, comes down into the nasal cavity. But I also wanted to show you about the nasal cavity. It's one of the areas where we have a lot of lymphatic tissue. And you have your tonsils and your adenoids that you talk about with kids, and this whole, what's called Waldmeyer's ring. And that is also affected by doing Nasya. So this is, and particularly right now, since we're dealing with a respiratory virus or something that's inhaled, we know that it is inhaled by aerosol. We have a way to actually build up some immunity topically. And one of the other things that the CDC is mentioning about the virus right now, the COVID virus, is that one of the symptoms is loss of taste and smell. And you can see now why, because taste is very much a sister to sense to smell. So just briefly wanted to show you the anatomy of the nasal mucosa. Just at a microscopic level, we have these little hairs that stick out, and they're in a mucus bath. And this mucus moves constantly and is regenerated constantly through the day. Sometimes we make a liter of mucus, and we're constantly dissolving particles, pollution, all kinds of things, viruses, bacteria. And we want to have a very, very healthy barrier there. And we want to have the cilia to be able to move things back so that we swallow them. They go into our stomach where the acid then does them in. So with the cilia are work with normal breathing. They can also be enhanced by blowing the nose, but sometimes due to buildup of dirt, they can become clogged and require washing out. And so I want to just actually jump one forward and talk about Jala, Neti, which is the actual cleansing out of the nasal cavity. So it's basically, as I talked about, that we have this mucus lining to trap bacteria and particles. And I'm going over all this because sometimes it's a hard sell to people. And I want you to understand why, particularly during this time period, this part of dinacharya is so important. But when we do Jala, Neti, and I'll show you in a moment, due to gravity and what's called the Venturi effect, which is a pressure that's created by having fluid pass a sinus opening, we actually can drain out by a vacuum the sinus passages, the eustachian tubes, and bring things into the nose and out. And it also benefits the tear ducts, which empty into the nose. It creates proper temperature and humidity in the nose, and it affects that relationship between our nervous system and our sense of smell. So really, really important. I'm going to show you in just right here on the left side. So the basic simple process, and this is just the simplest, you can look it up too, is to take 1 level teaspoon of sea salt, and not table salt, sometimes because that has additives in it. So we want sea salt in 1 cup of water that is either distilled or boiled and cooled slightly to body temperature. And you get this cup, it looks like a teapot. You can buy them at Whole Foods, you can buy them in a number of places, and you do just the way it's shown here. So what happens is this goes in 1 nostril, it goes around the back of the nasal septum and comes back out the other side. But as the fluid is going through, it's actually creating this negative pressure to pull things out of the eustachian tube, the tear ducts, the sinuses, cavities that are end cavities that, you know, we can't get into. So this is in addition to all the other things that I talked about. So this is something that would be lovely to do every morning as part of your dinacharya, especially now with what we have going on. And then I want to talk about nausea, which is now the oiling, if you will. We talked about oiling of the body, but now we're going to talk about the oiling of the nose. So I mentioned about the way the nervous system comes into the nose, but I also want to mention that respiratory viruses attach to nasal mucosa first. This practice is the first line of defense against viruses. So we have a way with these Ayurvedic techniques to prevent or maybe impair respiratory virus attachment at a physical level. So again, at a first line defense level. And it also, as a side effect or a benefit, prevents diseases of the eyes, nose, ears, graying of hair. It strengthens muscles, and it improves voice. That's one thing I always have to, I talk to teachers about and people who use their voice a lot. It improves cognitive function, and then obviously the clarity of sense organs, including smell, taste, vision. And then the only time you would want to avoid it would be after heavy meals, if you have wet hair right after a shower, during periods of severe stress and acute infection, like if you have acute infection going on. So,
And I would like to add a little bit about the Nasya also. That you want, for especially for the females, if you are on your monthly cycle, then also one needs to avoid that.
yes, thank you for putting, yeah, and I'll add that. So here's just going back to the nausea. So a drug can be transported quickly to the blood circulation since the intestinal tract and the liver metabolism are bypassed. So again, I give the example of snorting cocaine, which is a negative example, but a positive example would be to use nausea. And you can drip it into the nose a couple of drops away this head is positioned. And it's the same way I used to tell patients to put nasal drops, medical nasal drops, like if they were using a nasal steroid. So it's the same thing. And it actually, if you're sitting up and you put a drop in, it goes right back into the nasopharynx and you swallow it. If you look back here, you see if you put a drop right in here, it's just going to go back down into the throat. So you want to tip the head back the way it's shown here. Or with a clean pinky, a very clean pinky, you can put a couple drops on the tip of the pinky, and it's called Prada Marcia, and just kind of rotate it around in your nose. And you can use sesame oil or ghee, beneficial for pretty much anybody. And I cannot tell you how many patients that would have dry noses, recurrent nosebleeds, respiratory problems, that just simply having them do this. And it really does work. And so again, when we want to prevent the respiratory viruses from attaching, and we want to also kind of help that mucus layer that I talked